Welcome. I'm Hope Helfrich, and I'm with Wesley Medical Center. I'm one of the clinical educators, and I take care of student placements and some OB education. I have brought with me two of my good colleagues that are very well versed in intensive care nursing. Closest to me is Susie Blasey. On the other side is Shayla Potter. We have these two folks that will be answering your questions and spending some time with you this morning. And we are expecting the manager of our surgical intensive care unit, Cody Wilson, to be joining us in just a bit. We are actually in a dedicated SICU room, so there may be some traffic or some noises, but we will try to keep that down to a minimum. Just a quick shout out. We have questions and we will do as best we can. But if you do have questions that you would like answered, just go ahead and let us know. Maybe in the chat. We'll see if we can keep an eye on that. Or when we have a shout out for questions, please let us know if there's something you would like us to address. Another thing, just to remind you, we do have an evaluation we would love to have you complete. That way it gives us some direction about how we've done for the day and where we need to go in the future with the topics in the presentation. So without any further ado, I'd like to turn it over to Susie and Shayla.
And I have permission to take my mask off, so to take my mask off. One of the things we do in the hospital every day is we check into the hospital and we agree that we are not sick. We are here healthy and well to work, easy to work. And then we put our mask on for the day. So that's been in place for 18, 20 months, something like that, pretty close to 2 years since the pandemic hit the hospital, hit Wichita. And so we're used to wearing these things all day long, but I'll take it off so that you can see me and then I can talk to you a little more clearer. My name is Susie Blasey. I'm one of the clinical educators here at Wesley. My responsibility in the hospital is the adult intensive care units. So I do some training and orientation and some ongoing education, provide some of that to the folks that work in SICU. And MICU, medical ICU. Surgical ICU is where we're at today. Medical ICU is 2 floors above me. And we have a coronary care ICU where a lot of our heart patients go. Right now we have a lot of COVID patients in that area. And then we have the neuro critical care as well here at Wesley on this campus. And then Wesley has a Woodlawn campus, which also includes an ICU. It's a 14-bed ICU. It's not right here on this campus. It's across the city a little bit, maybe 5 miles away from here, but I do some education for those folks as well. So we're welcome to have you guys. I'm excited to get to talk to you today. You know, I love nursing. I love the science of medicine and, you know, bringing healthcare to folks when they need it the most. And so I'm excited that you're interested and maybe want to hear a little bit more about it. That's pretty exciting. So, yeah, go ahead.
And I'm Shayla Potter. I'm actually new to the education department. I've spent the last 11 years as a bedside nurse in the medical intensive care unit. So primarily I've been taking care of COVID patients for the last couple of years. So I've moved over to education now. And my focus is in the intensive care units and in the emergency department.
Hey, how's it going? It's weird. All right. My name is Cody Wilson. I'm the manager of the surgical ICU. I've been here at Wesley for 7 years. Been in all of my experiences been here in SI. Started as a bedside nurse and went to charge nurse after a couple of years. After worked at the bedside for about 3 years, I went into the manager role. And so I've been doing this for about 4 years now. Really love Wesley, love everybody that works here. That's really what's kind of kept me driving for so long here is all the people that I work with. So I really love nursing and everybody here. So we got some questions here, I think, this morning. So just kind of start with the top of them, I guess, right? So it looks like the first question I have here is how long are the shifts? So most of our staff work 12-hour shifts here in SI. We do all of our staffing in 4-hour blocks, so it is available to work anything in kind of 4-hour blocks. Our shifts run from 7 a.m. to 7 p.m. And so you kind of pick up any 4-hour block at that time, so 7 to 11, 11 to 3, or 3 to 7. But 90% of our staff work those 12-hour shifts. So they can be long, grueling shifts, but typically you work 3 days a week and then you get a couple days off during the week. So it's a little bit, you have a little longer weekend typically. Let's see. Okay, so how fast-paced is this area? This is a very fast-paced area up here in SI. In SI, we have our trauma population. So any of our level 1 trauma. So Wesley Medical Center is a level 1 trauma center. So it means that basically any trauma that happens, we can care for the patients here. We have all the specialties, we have all the physicians and everybody to care for any type of injury that happens. And so if it's a ICU level patient that comes in, they'll come up here to our surgical ICU. And so that makes it a very fast-paced environment. We have a lot of patients coming and going, and a lot of high acuity injuries. And so we're constantly moving patients out to get new ones in, and doing some pretty high level stuff for our patients.
I would say too that in addition to what Cody said about the trauma departments, or the trauma kind of focus of this unit, they get other patients too, not just traumas, but traumas is a big part of what we do. So if you're involved in a car wreck, any kind of trauma, it could be a gunshot wound, it could be a fall. I'm trying to think of some more recent things that we've had. This time of year, especially when it gets cold, people slip and slide on the roads, and there's a lot of car wrecks and things like that. And if it happens in the vicinity of Wichita and you get transported to Wesley, those patients first hit the emergency department, and then they come to this department if they're sick enough, if they're hurt enough to need intensive care. But we also serve the community around our area too. So we have helicopter access for trauma patients. So if it's a rural area and someone gets hurt or injured or in a wreck or a farm accident or any kind of trauma, really, a gunshot wound, those patients can be flown here as well and received in this department. So yeah, that part of the SICU is very high pace. Things have to happen pretty rapidly.
Absolutely. Sorry.
Let's see what different medical personnel work in this unit. Primarily nurses, but we do have patient care techs, nurse techs, or nurse externs, and those are students that are typically in a nursing program, working on their nursing degree. We also have respiratory therapists that come on the unit, pharmacists that are readily available. Yep, physical therapists, occupational therapists, speech therapists, dietitians.
What they do.
It's a PCT.
Oh, what's a PCT? Yeah. So a patient care tech is so most of the time that is a person kind of like you guys that are interested in healthcare. You're probably past graduation, but if you high school graduation, and some of them have a little bit of training in some nurse aid kind of certification area first before they come to the hospital, although it's not absolutely a requirement to be a patient care tech. So those people kind of come in, kind of learn the role. Many of them are going to school or thinking about going to school. So they might not work full time. So they're flexing their days a little bit so that they can attend some classes or continue on with their education. But they're a very vital role to the nursing staff in this department. They assist they're another set of hands in lots of things that we do. There's things that they can't do without a nursing license. You can't pass medications to patients. You can't do assessments on patients. You can't put lines in patients and things like that. But we do ask them to assist all the time in a lot of our cares that we give to patients. So if you're interested and after graduation, if that's something that you want to kind of look into, absolutely come talk to us. We're more than happy to kind of share what that looks like. And then if you do decide to delve into nursing school, pre-nursing or the curriculum that you take before actually nursing school, we have this nurse extern role that Shayla talked about, and it's an advancing role. So each time you pass a semester, you add on to your duties at the bedside. So it really helps prepare you for becoming a nurse outside of nursing school when you graduate. I did that when I was in nursing school. I can't imagine not doing that when I was coming out and being a nurse in a unit for the first time. So it just gives you some kind of experiences in the hospital, which is very, very helpful. How much do you need?
Experience.
Experience do you need? Yeah.
So we do hire new grad nurses into the SICU. So we don't require any experience necessarily to work in the SI. We do prefer experience. We do like to have, at least a year or two of nursing experience. It doesn't necessarily have to be in the ICU. Any type of nursing experience where you've had taken care of patients and then worked in a hospital setting is very beneficial as you come into the ICU. Starting in the ICU as a new grad can be a very, very big challenge because you don't have any of your skills developed, any of your knowledge there yet. And so it can be a big pill to swallow to try to come in here and learn everything that we're trying to teach everybody while still trying to develop your own skills. So we do hire new grads. It's not as common, but yeah, we look for experience, about a year or two of nursing experience in our candidates. Let's see, and then what is the pay structure and what can you do to advance to get paid more? They have a pretty set pay structure here, and it's kind of decided what the starting new grad wage is, and then every year we do performance reviews essentially, and depending on how you do it throughout that year, you'll get a structured wage increase essentially. So it's a yearly wage increase that's met with you and the employee and their direct supervisor. Let's see. What are the normal things you do on a daily basis in the SICU? There's a lot of different things. It's hard to describe a normal day in SI because there really is a lot of different things that we do. But every morning we get here, we get a report from the previous shift. So we figure out what happened on the previous shift, learn about our patients, and figure out what's going on to that day. One of the first things that we do is go in and we do our assessment. So we go in and assess the patient. And make sure we understand, everything that's going on. We talk to them, look at everything, and make sure we know what's going on with that patient and going on that day. Pretty shortly after that, after we've assessed our patients, we're given our first medications that day. We're given IV medications, oral medications, any type of meds that patient may need. They'll start giving them that morning, and then they'll give them throughout the day. They've got other meds that aren't scheduled for the morning, and they'll give them throughout the day. And then it's just kind of a little bit of a free-for-all and just kind of whatever happens with your patient, whether you're going down to CT or MRI, you're taking them to surgery, you're taking them to cath lab, you maybe stay on the unit and doing procedures on the unit. We do a lot of procedures at bedside here as well, so you may be able to do those at bedside or you may have to leave the unit to do them. It's a lot of different things that we're doing here, and just depending on what patient you have and what's going on with them that day is going to kind of determine what you do throughout that day. So typically our nurses do have 2 to 3 patients right now, or 1 to 3. We do have in SI, we have some very high acuity patients that require one-on-one care, specifically our post-op heart. So if they go for heart surgery, right after that surgery, they are one-on-one care. So it's either 1-on-1, 2 to 1, or 3 to 1, depending on the acuity of the patient or how sick the patient is, depending on what resources we need to care for that.
And I would add to that, kind of with Cody's remarks there, is, a typical day of an ICU nurse, including the SICU here, is that every day is different. You will not see the same thing every day. If you're, looking at a job that is, you come in, you do your thing, you do have a routine, there is a routine that he was mentioning that we have pretty much every day, but things change on a dime in an ICU setting, and you have to kind of, think ahead, kind of critically think what problems could happen with my patient and be ready if they happen. And so every day is a little different. You won't have one day that exactly matches the very next day. The other thing that's kind of unique, I think, to nursing is that when you take care of your duties for the day, and your shift is up and you report off to the next nurse, your work is done. So you leave the hospital and that's kind of your chance to decompress. You get a chance to kind of unweigh all the duties that were placed on you that day. And some days it's kind of life and death duties, it's the things like helping families cope with things. And, you're taking care of a very sick patient that could go bad on a dime that you have to be ready and aware and be able to treat and call for help on. But the minute you leave the hospital, you've turned that patient load over to a different nurse. And that's really your chance to kind of take a deep breather and kind of unload, because it is a stressful job, and you have to be ready when you come back either the next day or you get a couple days off, you get to come back and you get to take it all on again. So just kind of keep that in mind, that it's different than other work in other maybe businesses or manufacturers where your work kind of sits there until you get back and then you get back into it. And that's not how nursing runs. You unload it and then you come back and you get a whole new assignment for the next time. Okay.
See, so what level of education do the different medical professionals need that work in SICU? We have a pretty wide variety of experience and of education levels that come in here. Obviously, ranging from up for some of our physicians that are medically trained, and they're looking at 10 years of school and another 4 to 8 years of learning on the job essentially before they're able to start working on their own really. And then we, like Susie was saying, we do hire PCTs that have very little formal education and can come in here and start helping and working on the unit pretty quickly. So the most common is a bachelor's prepared. I believe that's what our respiratory therapists are as well, right?
Yeah.
Our bachelor's prepared. Most of our nurses are either associate's degree or bachelor's. A lot of them have their bachelor's, though they're starting as associates and then kind of bridge over to the bachelor's. And so that's the most common level of experience or education. And then obviously we use therapists and physical therapists and speech therapists, and they're more of a master's level prepared, I believe, where they're going for that's about 6 years of schooling to be able to do their job.
And even if you come in with an associate degree or a bachelor's degree, this is an environment where you're going to continue to learn. And that's my job and Shayla's job is to kind of continue to bring to you and or if we don't have the knowledge, we're going to find someone who does have the knowledge and bring it to you on current treatments and modalities and medications and equipment. All of that changes very, very routinely. And so, once you get done with your education, you think you're done with school and you come and work on a unit in the hospital, and Susie and Shayla are coming at you saying, you need to come take this class and you need to come do this checkoff, because it's one of those things where we will continue. I've been a nurse for 38 years and I learn every day that I'm here. I learn something new, or I'm looking up something to tell someone else about a new therapy that's brought to the hospital or new medication. So we rely on a lot of our disciplines for that expertise. I certainly don't have every expertise. So respiratory therapy, pharmacy, physicians, we ask a lot of them to kind of bring that to us when we need it. But it's one of those kind of jobs where you will continually learn. You'll be a nurse for 38 years and continue to learn. So.
Also, some of the certifications that kind of go along with ongoing learning as a nurse. You have to be certified in basic life support and advanced life support. They changed the name recently.
They did.
You do have to have both of those certifications to be an ICU nurse. Another certification we require on a yearly basis is a stroke certification. And that's renewed yearly, and that just helps us to assess severity of our stroke patients. The BLS and the ALS that I just spoke of, those are renewed on every 2 years. So those are just a couple more certifications that nurses require to work in the ICU.
a lot of questions here.
Yeah. And then, yeah, the cost of the programs are pretty variable just depending on what school you go to. You can go to a very expensive private school to get your education, but, I personally went to a community college and received my associate's degree from a community college, which is obviously, in my opinion, one of the cheaper routes to go. And then I bridged into my bachelor's from there. I elected to go with WSU from there and got my bachelor's through there. And that was able to kind of do it at my own pace and at my own, when I was able to pay for it. So that was really nice, able to do it kind of my own pace that I want to do. I did not, no.
Yeah, I used a tuition reimbursement program. I went to KU School of Nursing, and back in the day, I told you I was been a nurse for a long time. So back in the day, there was a nursing shortage, and there were some offerings at the time, which kind of is now too. There was some offerings at the time for tuition reimbursement, where I just pay my tuition, but if I elected to work for this hospital after I graduated, they would reimburse my tuition and my books. And it still is very expensive. Back in the day, I felt like it was like buying a house. It was a very expensive endeavor to pay tuition and books. And so I elected to do that. I had some support to pay for my tuition and my books and get me through the last 2 years of my nursing school. So there's those offerings out there. Wesley offers some tuition reimbursement. I know other hospitals do too. Some of it is in a promise to work here when you're done. But it's usually like a year for a year, but it might vary. Different contracts vary a little bit. So I highly encourage you, if you're going through nursing school and you're interested in a certain department or hospital or a certain type of patient, to kind of seek out that information. I think you'll be ahead of yourself if you seek it out, because they won't come to you. You'll have to seek it out. But it can really, really help you financially. Okay.
I'm gonna skip down here and answer.
You're so much talking about the unit.
Oh, okay, go ahead.
Yeah, that's the entrance into the SICU. It looks like calm and peaceful right now in that video, so, which is kind of unusual. This is a typical patient room, the bedside monitor, equipment that's available for every patient. It looks pretty spacious, but this room fills up pretty quickly. There's a crash cart here. The crash cart is actually shared by a number of rooms. He pushed it in the room so you could see it, but various drawers with various supplies. And this would be if a patient's in the middle of an emergency where, we're trying to save their life, something acute has happened that we're need to intervene on. So we can pop this full plastic lock and access medications, equipment, anything you need for line insertion, things like that. And you want to talk about the Pyxis?
Oh, that's just our Pyxis there. That's where we store all of our medications. They are pulled by nurses. That's a nurse's desk right there, a station. That's where we do our charting. We're sitting right outside the patient's room so we can keep an eye on them.
This is a hallway on that side here. You can see the patient rooms on the right and the nurse station on the left. And this is one of our IV pumps. So we use that to infuse medications. We have these carts here. They're called comfort care carts. So we have patients or families passing, and we'll put outside that side of the room. They've got nice little things for families to help kind of in the moment of loved ones passing. So that's what we'll put outside the room when they were having that situation.
And here in the SICU, there are 26 beds. We actually have 4 different ICUs here at the hospital. There's the surgical ICU, cardiac intensive care unit, medical intensive care unit, and the neuro intensive care unit. And the patient population is different, of course, on each floor. Our neuro ICU sees primarily stroke patients, patients that have had seizures, anything going on with the brain. Even an accident that caused, trauma to the brain, they might be over in the neuro ICU. Like I said, I used to work in a medical ICU, and which has kind of turned into the COVID ICU these days. But prior to COVID, we'd see a lot of diabetic patients, let's see, alcohol withdrawal patients, overdose patients, a large variety of patients in the medical ICU. In the cardiac intensive care unit, they see a lot of heart failure patients, patients that have had heart attacks, heart arrhythmias.
Pretty much anything. CCU will have anything to do with the heart that doesn't require surgery. They'll do interventions and they'll go to the cath lab and put stents into the heart that way. But if they require surgery, then they'll come down to us in the SICU. But otherwise they deal with pretty much everything else with the heart if it's involving the heart.
So what kind of questions do you guys have, and we can help with?
Hi there, Rob Archibald from Mays Career Academy. So one I had might be just in general education-wise. It seems that a lot of the individuals that have the words technician after their name, that's typically going to be like a 2-year program, I assume. And then the nurses, it varies so much, but the technician role, I'm kind of doling out information as I go, just to kind of educate my kids as well. So if I say something wrong, fact check me. But if someone has, if they have a technician as in their name and their title, it's typically a 2-year non-degree seeking program they can get from various colleges in town. Is that a career field that is in higher demand or is always in demand, or how badly does Wesley need technicians currently?
Yeah, we're definitely recruiting and hiring a lot of technicians right now. We're looking and we definitely in a need for any of those techs right now. We need them in ICU. We need them on the med-surg floors. I believe the peds world needs them as well. So there's pretty much any, if you have an interest in a certain type of patients or anything like that, likely they're going to need techs right there in that area for them to help. So we are in a high demand for patient care techs right now.
But that's not a 2-year degree.
That is not. It's typically not a 2-year degree.
So you have to just differentiate between like tech, scrub tech.
Yeah.
Right. Because there are, and I'm not as familiar with them or schooling, but there are their scrub technicians as well that they work back in the OR, and that is a 2-year program that's pretty intense, is my understanding, and you have to learn a lot of different medical tools essentially, and knowing the names and specific jobs for each tool back in the OR, and so it does require a lot of schooling, a lot of really memorization and understanding of those tools. Our patient care techs don't require as much schooling. I do think they require a CNA license, and so that it does not require a CNA license.
It's preferred.
It's preferred.
Yeah.
And so, then you can go through some schooling for that, but otherwise it is not required for our patient care techs.
High school diploma, life support, 18 years old.
Okay.
Yeah.
Yeah. So having the basic life support certification, being 18 years old and a high school graduate essentially is the only thing required for those patient care techs.
And then anticipate that you're going to get a lot of training on the job as part of your orientation to your new job.
Yeah.
We'll check you off on a number of things, meaning that someone's going to watch you do it. You'll probably observe several times some skill, and then someone's going to watch you do it and see that, give you some feedback on how your performance is. And then they won't sign you off to do it independently until they've seen you do it. Perfect. So, and there's a big long checklist of what we want you to do that would be tasks that you would be asked to do in front of someone and then on your own once you've been checked off. So that's all part of orientation. And you'll be given some time paired with another nurse or a preceptor to be more introduced specifically to on-the-job kind of training. So you'd never be asked to do something that you weren't familiar with or didn't have a resource for. Yeah.
That's perfect. I appreciate you.
Yeah.
Thank you for answering that so thoroughly.
Okay. Anyone else? I'm interested in what kind of things brought you guys into the Health Academy courses that you're interested in. I can tell a story about what got me interested in healthcare. Probably most nurses can. Most people that I work with can. But I'm interested to hear from you guys. Is there some experience you had, or just a love of science, or you like how the body works? Kind of all
I
those
think,
things.
I think the biggest draw to our program is me. Getting to take a class from me is just a once in a lifetime experience. Yeah.
Can't pass that up.
I should've known.
Opportunities.
There's a lot of laughing going on, and I don't really know. I feel attacked. I don't know. What do you guys? We can kind of start by scanning, and see if you guys have. I don't know. What do you guys? Can you at least kind of tell what you guys are thinking about going into? If you have some idea, realm, right here. Midwife. There you go. Okay, and back there. NICU, see, so kind of the same ICU kind of situations. Peds, sports medicine. You can tell from that manly voice, he's a man.
Yes, yeah.
L&D, labor and delivery.
Okay. Yay. Yay, that's Hopesfield. Yeah.
I'm not gonna lie, I honestly think certain TV shows and the popularity of like just even like Grey's Anatomy and Scrubs and shows like that have honestly shown. I know that sounds cliche, but
Yeah.
some of these kids religiously follow them, and I think that I notice a lot of my student population is female, and I think there's a lot of that natural nurturing desire, just wanting to help in general seems to be a big role. So I think that that's one of the reasons we really look up to and honor people that are in your guys' role, just because like you want to help, it's not just, preparing food or helping clean. Like, no, I want to help you live. I want to help you get better. And I think that's a natural draw that most people have somewhat innately. So.
Absolutely.
Well, I think there are professions, that make a lot more money than a hospital nurse would, or another discipline here in the hospital, several that you guys talked about. There are, other businesses that as an employee, you would make a lot more money. I'm comfortable with my income, but, some people might not. But I think that, part of what you're talking about, you want to help, you want to save lives, you want to make an impact in a person's life. That's part of kind of why you seek this kind of employment. It's not just the income. Of course, we have to live off of our income, but you have to have that drive too, I think, underneath, or just making a paycheck isn't going to keep you here. It's a lot of stressful days. There's days you see things that you just can't hardly believe have happened, and that there's a lot of sad days that you take care of patients and their families and things don't turn out well. And, it's stressful on a day-to-day basis to deal with that, try to take the good outcomes that we see and, live off of those a little bit too, which there's lots of stories that we could tell you about those bad days and good days.
Mhm.
So, yeah, I think, for me, I went into college having no clue what I wanted to be, and took some gen ed classes, things like that. And I thought I wanted to be an artist. I'm not even that good at art. And I ran around KU's campus with a big portfolio with my art in it. And I had no clue about being a nurse. I liked sciences, but I didn't anticipate being in healthcare as part of a career. And then I quickly learned within a few days, actually, as an art major, that that's not what I wanted to do. And and started delving into some of the science classes I was interested in. And then I had a personal experience. My dad passed away at a young age, and I was helping him, and I thought I needed to know more. I was interested to know more. I wanted to know how I could, make myself more healthy, my family more healthy. I was always very interested in biology and how the body works. I was always kind of interested in athletics and things like that. So I kind of dug into that side of it, and that's where my kind of love for healthcare and for nursing came about. And but you have to have that kind of empathetic heart, I believe so too, to want to help people in their hours that they really need the help. So that's my story. I think most people
Yeah,
have.
I actually I went to college on a basketball scholarship, so I played a couple years of basketball, and then so my focus was primarily exercise science because that was right down my alley. I ended up getting a bachelor's in that field, not really knowing what I was going to do with that degree. I was a personal trainer for a little while, but I didn't really know what paths I could take with that degree. I knew nursing had a lot of options. There's so many fields in nursing that you can work in. And it just takes getting out there and getting your nose, in that information and finding out what speaks to your heart and what you love to do. So I went to nursing school. I got my bachelor's in that. And my first job out of school was in the medical ICU here at Wesley. And I quickly found that that's what spoke to my heart. So I've been here ever since.
Okay.
Let's see. You guys have any other questions right now you'd like to ask us? We can go through some more of these if you don't have any specific questions.
Just so I can make sure that I'm right, because I had the technician thing wrong. I have a lot of students that go through into nursing school, and I guess the way I've understood it is nursing school is kind of it's not, for those going into college, you get your 2 years of undergrad or your 2 years of general education, and to pursue a bachelor's of science in nursing to become an RN, you don't really go to nursing school. It's just that you gain access to graduate and finish up the last 2 years of that degree. So basically it's, you state your major and say, okay, sophomore year, at the end of this time, it's time to declare my major. I'm at K-State, KU, or Wichita State. I want to get a bachelor's of science in nursing. In other words, I want to apply to nursing school. It's like, well, you don't just get to say, I want to major in this. You have to apply to do it. And that's essentially what applying to nursing school is. You go through an application process. And at that point, if you are accepted at nursing school, you are then given permission to pursue and complete the last 2 years of your degree. So then just say you graduate from KU, K-State, WSU, and you've got your bachelor's of science in nursing, you want to become an RN. The last step is you have to pass your boards, and then there's a specialization you have to do as well. Like, I want to specialize, or what's that? Like, if I want to be a nurse who does cardiology, or someone mentioned labor and delivery, what's that last little piece on there? And I apologize if you already said it. I had a student ask me another question.
That's perfect. And then, yeah, you described that perfectly. Yeah, you apply for the nursing program, and then you're accepted. And then once you're accepted, you go into that nursing program for 2 years, and then get licensed at the end of it. As far as specializations, there are certifications that you can get after you've worked in a field for so long, but typically they want you to have experience in that area first. So really, there's no specialization. You apply for a unit that you're interested in working after you have your nursing license. You work in that field for usually it's 1 to 2 years. Usually they do ask for about 2 years of experience, and then you can take another test and be certified in that area and be specialized as a certified L&D nurse, or for us we call it the CCRN, which is it's a critical care registered nurse, and it's a special certification for our nurses to show that I've worked in this field for 2 years, and I have the knowledge and skills to be able to really be excellent in this field. And that's what that test and that certification shows. So it's not required. It's nothing that we make our nurses do. We encourage them to do it because it does add another level of certification and knowledge and skills for them. Not required, but something they can do.
Yeah, most hospitals provide an incentive for that. Here at Wesley, they let you, they'll pay for your exams for certification for the CCRN that Cody mentioned. And then they give you a little bonus when you pass your test. And then when you renew it every 3 years, they give you another little bonus, which is really nice. So there's this encouragement for ongoing education. Someone had a question. She's muted.
There you go. Whoops.
Try again. We didn't hear you on that question.
Right? I'm unmuting her. She's unmuted.
We can see you, but we can't hear you.
Melody, I keep unmuting you and you mute yourself. So here, you unmute yourself. I won't touch it. Nope.
Okay,
There
one of
we
my,
go. So,
Now we can hear you.
okay, one of my students want to know if you have a memory of the most critical trauma case that has ever come to SICU in your career.
I mean, I definitely, I don't know if, I mean, we've had some very sick patients, I could think of one in particular that we had when I was as a manager. We had a patient that was a young guy. He was involved in a rollover accident. He actually ended up being crushed by the vehicle. So it was a vehicle. He was actually, I believe, spraying something off the side. He was actually standing on the side of it, and the vehicle rolled over and created a crush injury to his chest. So had a lot of lung injuries, a lot of rib injuries, a lot of stuff, a lot of injuries, and his lungs were failing him. It's a newer device, newer machine that we started using here in SI. It's called ECMO. It stands for, I'm gonna butcher this, extracorporeal membrane oxygenation.
That's good.
I haven't really making work up to that one. And it's basically we're oxygenating the blood for the patient outside the body. So we're doing the work of the lungs for the patient. It's a very advanced procedure. It's not something we do very often. He was a great candidate for it. He was young. He was healthy. He had a very acute injury to his lungs that we knew that his lungs were not going to function well enough for him to live. So we needed to give time for those lungs to heal. And so we were able to get him started on this device and machine. We quickly transported him to Oklahoma City, and they cared for him for about a week, and they transported him back afterwards. And he did very well and was able to live go on and get out of the hospital afterwards. And I know that if we hadn't been able to intervene with that machine and that newer technology, he would not have made it out of the ICU. So that was the one that really has always kind of stuck out to me. I wasn't directly involved in that patient. Like I said, I was the manager, and I oversaw it and kind of helped a little bit, but it was really the nurses that were driving that and making that happen. So it was really cool to see that and kind of stand back and watch the team work and watch everybody communicate together and say, this is what we need to do for him. And then get the ball rolling and get it going for him. So that was a pretty cool situation for us.
I can think of a number of cases that stick out in my mind. Some of them were, when I was in my first year of practice here as a nurse, that stick out in my mind. That's why I was mentioning earlier, kind of take a hold of those success stories and kind of live by them, because there's a lot of not successful stories, or several anyway, that also stick out in my mind. But one I can think of that happened very recently. We've had several COVID patients that have been pregnant, developed severe COVID pneumonia and multi-system failure, like their kidneys failed, their gut failed, their lungs obviously failed, their heart was failing, and they were also pregnant. And so it took a big team effort to get one that I'm remembering in my mind in particular, get her through her acute illness. And she was here for over almost 2 months, really. But she survived, and her baby survived. There was a team ready to get this baby out of her if she needed it at any minute. But we wanted her to stay pregnant as long as she could stay pregnant, because that was what was best for the baby. And she ended up, leaving our facility pregnant, which was great. And then she came back and delivered her baby at the term time when the baby was much easier to be born and survive. So huge success. We had to support her kidneys, support her lungs, support her heart during that whole time. So, and I know that if we weren't there to help her, she wouldn't have been able to see. This is what happens. There you go. They need the crash cart.
Somebody just crashed.
Sure.
Did you see that?
Do you need us?
Not the crash cart, so someone just heart stopped.
You guys see that?
Cody's going to go back. Well, that was
So that's real life. Yeah.
So, wow, what a wild ending to our little visit today. What I would like to say is that that is a true life story that we are dealing with right now. And we only can say a few prayers and support, and these girls were ready to run if they were needed because they are the experts in that area. So we are grateful that you guys were able to give your time today. I appreciate it very much.
Absolutely. Yeah.
And then Cody as well. And what I'd like to say again is thank you guys for taking your time. This is just an opportunity that we want to share a little bit about why we do what we do and how we do it. So please take your evaluations and complete them, turn them into your instructor, and then we will get them and we will look at them probably later this week if we get them in our hands. We'd like to be planning for 2022 because we will continue this series on. And those of you that are coming to the career launch and have not submitted your paperwork, boy, I tell you what, Scott and I are ready to have it. So please fax it to us. My fax is 316-962-3041. And we will like it in our hands by end of today. We've got to have a little firmer grip on what we're doing and what we're feeding you guys. How about that? So thank you very much. I appreciate your time.
To see you at Wesley someday.
Yeah.
Absolutely. Merry Christmas.
Thank you. We love you. Woo!
Clinton?